Hi, I'm Sheila Punayo from Batch 2183. I'm here to demonstrate the nasopharyngeal suctioning. Nasopharyngeal suctioning is a performed to remove secretion from trachea when a patient is unable to clear them independently. For adult suction, the mouth first, then proceed to the nose. This is done for the aesthetic reason. Here are the equipments to be used. Wall suction or portable suction unit, connecting tubing, the sterile saline solution, disposable sterile container, the sterilized suction catheter, the number 16 French for an adult, sterile glove, clean gloves, goggles, overhead table, and waterproof trash bag, and the towel. Good morning. Hello, I'm Sheila Punayo. I'm your caregiver today. May I know your name, please?
Yeah.
And when is your birthday?
June 27.
Is that okay to check your list? The procedure that we are going today is the nasopharyngeal suctioning. By stimulate transient coughing and or gagging, but it helps to mobilize secretion. Is that okay to you?
Wash your hands. Hand washing reduces transfer of microorganisms. Close the curtain or door to the room. Put screen. It maintains the client's privacy. Gather and place the suction equipment on the client's overbed table or bedside stand. Position the table or stand on your preferred side of the bed to facilitate suctioning. Connect the tubing to the suctioning unit. Date and open the bottle of normal saline solution. Open the waterproof trash bag. Turn on the suction from the wall or portal unit and set the pressure according to your facility policy. The pressure may be set between 100 and 150 mmHg. Occlude the end of the connecting tubing to check suction pressure. Tube occlusion test suction apparatus. Higher pressure causes excessive trauma without enhancing secretion removal. Place the client in semi-flawless or high flawless position, if tolerated, to promote lung expansion and effective coughing. If the client is unconscious, position the client on his inside facing you to help promote drainage of secretion. Side placement promotes forward drainage of secretions. Place a towel across the client's chest. Towel prevents contact with secretions. Using strict aseptic technique, open the suction catheter kit or the packages containing the sterile catheter, container, and gloves. Don the gloves. Consider your dominant hand sterile and your non-dominant hand non-sterile. Using your non-dominant hand, pour the saline solution into the sterile container. Lubricate 3 to 4 inches of the catheter tip with irrigating solution. Lubrication prevents mucosal stroma when catheter is inserted. Pick up the catheter with your dominant sterile hand and attach it to the connecting tubing. Use your non-dominant hand to control the suction valve while your dominant hand manipulates the catheter. To measure the depth from tip of the nose to tip of the earlobe. Raise the tip of the client's nose with your non-dominant hand to straighten the passageway and facilitate insertion of the catheter. Without applying suction, gently insert the suction catheter into the client's nares. Roll the catheter between your fingers to help it advance through the turbinates. Continue to advance the catheter approximately 5 to 6 inches or 12.7 to 15 cm until you reach the pool of secretion or the client begins to cough. Using intermittent suction, withdraw the catheter from the nose with a continuous rotating motion to minimize invagination of the mucosa into the catheter's tip and side ports. Apply suction for only 10 to 15 seconds at a time to minimize tissue trauma. Between passes, wrap the catheter around your dominant sterile hand to prevent contamination and clear the lumen of the catheter by dipping in the water and applying suction. Repeat the procedure up to 3 times until gargling or bubbling sounds stop and respiration are quiet. Allow 30 seconds to 1 minute to allow reoxygenation and ventilation. After completing suctioning, pull your sterile glove off over the cold catheter and discard it and the non-sterile glove along with the container of water. Glove removal reduces transfer of microorganisms. Discard the used item and replace with the new supplies so they will be ready for the next suctioning. Having the supplies at the bedside facilitates a quick response. Remove personal protective equipment and wash your hands. Hand washing reduces transfer of microorganisms. Let the client rest after suctioning while continuing to observe. The frequency and duration of suctioning depends on the client's tolerance for the procedure and on any complications. Record the date, time, reason of suctioning, and technique used, amount, color, consistency, and odor, if any, of the secretions, the client's respiratory status before and after the procedure, any complications, and the nursing action taken, and the client's tolerance of the procedure.